Dear colleagues, so glad to present to you a new COVID-19 related medication error in one Iraqi hospital. We thought that this kind of error is not confined to our country, but might also occur in any other part of the world as well. My name is Manal Younus. I'm the head of Iraq Pharmacovigilance Center, ISOP board member, and ISOP Middle East Chapter Scientific Committee member. Presenting on behalf of my colleagues Mushtaq Madhat, Han Kamal, and Hudayfa Dhafar from Heat General Hospital, Al-Anbar Directorate of Health. The importance of this presentation is to shed some light on how the safety of health personnel might affect the patient's safety. And what I'm going to present just came in line with the this year WHO slogan and theme for patient safety. Hope you will find it an interesting one. We will go through the introduction and objective. We will present the case, and we will try to classify the case based on psychological approach and do some outcome assessment in addition to the management and recommendation, and what would happen if the patient was the medicine, what would happen if the medicine was reached the patient, in addition to conclusion, and we try to collect all of these in 2 slides in our storyboard. There are many definitions for medication errors, and one of the most reliable one is that any harm resulted from the treatment process rather than the drug, or it is the result of the failure in a step of the treatment process. And accordingly, adverse drug reaction is a non-preventable event, while medication error is a preventable one. So before COVID-19, we know lots about medication errors, and we have lots of lessons learned from these medication errors. However, during COVID-19 pandemic, many medication errors yet to be introduced to the worldwide community, and while going through the references for this presentation, we found maybe only 1 or 2 references that mentioned a medication error related to COVID-19. So the following slide will describe a very interesting medication error involving COVID-19 personal protection equipments, its effect, assessment results, and recommendation for prevention in one of the Iraqi hospitals in Heat General. The patient was 47 years old male, suffers from prostate hyperplasia, and diagnosed as a positive COVID-19 case that required admission according to Iraqi COVID-19 treatment guidelines. Prescribed medications included doxycycline tablets, Cardura, besides other COVID-19 medications. On the 5th day of admission, pharmacist responsible for delivering the medication to the patient dispensed Cordarone ampule instead of Cardura 4 mg tablet. The system used for delivering medication in all public hospitals in Iraq is paper-based unit dose system. Taking into account the differences between Cordarone and Cardura, where Cordarone, amiodarone, is indicated in the treatment of different types of cardiac arrhythmias caused by blocking certain electrical signals in the heart, and the parenteral form used in emergency life-saving situations, while Cardura, doxycycline, blocks alpha receptors used in the treatment of hypertension and benign prostate hyperplasia. So this is the core of this the case that we are going to analyze and see what kind of recommendation that we will have after finishing this one. Using the psychological approach to classify this error, it was found that it is not a mistake. It is not an error in planning actions, but it was an error in executing correctly planned action. So it was a skill-based error. Going further into the classification, it was an action-based error because the newly graduated pharmacist failed to recognize the poor physician handwriting, the pharmacist who was wearing the the level 4 PPE with medical glasses covered with the goggles that caused the fogging. All of these were factors contributed in this error. Now we want to classify the severity of the outcome of this error. We use the National Coordinating Council Medication Error Reporting and Prevention Index that consists of 9 categories starting from A and ending with I. The outcome according to this index are 4. Either there is no error, or there is error but no harm, or there is error and harm, or there is error and death. And according to this one, as we will see in the next slide, how we did categorize our error in this case. Using the corresponding algorithm, the error was assessed to be category B. Okay, what's category B? By answering the first question, did an actual error occur? Yes, there was an actual error. The pharmacist dispensed one medication instead of the other one. And coming to the next question, did the error reach the patient? The meaning of reach the patient here, did the error cause harm to the patient? The error did not cause any harm to the patient. That's why it was categorized as B. Also, there was a kind of error. It was an omission error. So that's why we choose category B for this type of error. Now, we have the category B error at the dispensing level with the action-based, skill-based error. This is the outcome of the analysis of this error. The hospital adopted several recommendations, starting with informing our center about the incident, and our center to send a letter to Kimadia, which is the centralized Ministry of Health procurement body for all public health institutions, to change the type of goggle from no filter to the one with filters to prevent fog formation. Increasing patient involvement in treatment process was helpful in this case, so they thought that it would be helpful for other patients also to get involved in their medication process. In addition to improving communication between the medical staff and the patient, and active medication chart review before dispensing, letter to all health workers in the hospitals to increase awareness regarding such errors and encourage them to report these errors. Finally, stressing the importance of completing the training of all the staff before giving them responsibility is also a very important recommendation. So what would happen if the patient received Cordarone? Cordarone is a well-known medicine for many adverse events and drug-drug interactions. However, its uses in COVID-19 patients is still not studied also. So, if the intravenous injection of this medicine reached the patient, it might have been administered for not only one dose, but for many doses, and going unnoticed because of the workload of COVID-19. Maybe patient may end up suffering from adverse events of this medicine affecting the heart and liver. We know that this is the worst scenario that we can imagine till now. To conclude, healthcare service during COVID-19 added a workload and stress that may generate new medication errors. The presented case shows a new medication error resulted from the use of improper goggles that caused fog. Added to it, the poor handwriting of the prescriber. It was categorized as a near misslip with category B according to NCC MERP risk assessment. Recommendations included using goggles with filters to prevent fogging, increase patient involvement, and enhance communication. Now I want to leave you for a few minutes with the storyboard, where the head of pharmacy was informed that there is one of the medication of this patient is not the usual one that he is using, and accordingly the head contacted the pharmacist that dispensed these medication to the patient, and after reviewing the medication chart, they found that there was a dispensing error. Since the pharmacist dispensed Cordarone ampule instead of Cardura tablet for the patients. This error could be attributed to the many factors. One of them is the goggles. So the pharmacist was wearing medical glasses covered with the goggles that was with no filter, causing lots of fogs that he wasn't able to read the physician order. In addition to that, the poor handwriting of the physician also played a role in this specific kind of error. As you can see, they decided to take several measures and recommendations as mentioned earlier. And with that, I would like to thank all of you for your kind attention and hope that the case that we present would help to address the same kind of issues that might occur in your institution level. And we might even reach zero patient harm, as we are all hoping. Don't forget to follow ISO on our websites, our tweets, on Instagram, Facebook, and on LinkedIn. See you all. Bye.